Well, good afternoon. Thank you for joining us this afternoon. I'm Jeff Ray. I'm the president and CEO of the South Bend Regional Chamber. We're grateful for you joining us today for our Networking at Lunch event. And those of you who have joined us before know that we like to get together periodically to talk about issues that are relevant. And we think we've got a really pertinent, timely one for you today as we talk a little bit more about vaccines. Historically, we do networking at lunch in person for that very purpose, so that you can network with other business leaders. Obviously, that's somewhat complicated by the pandemic, but our hope is that relatively soon we're able to get back together with you and we can resume those great networking opportunities. I'm encouraged by the COVID numbers and where they're going, and with the rollout of vaccines, I'm confident that hopefully by summer we're back into somewhat more of a normal situation. We can't do the events we do at the Chamber without great partners. Our partners for Networking at Lunch is Gibson, and you'll hear from a couple of our friends from Gibson during the course of this, but you've got a chance to meet many of the Gibson team through our previous Networking at Lunch. We're grateful for their investment in the Chamber and their partnership with us and their efforts to help other employers really understand best practices and such. And so we'll go through that a little bit today. So let me, as we get into this, maybe just give you one quick logistic thing. You are, participating in this. There is a Q&A button on the bottom where you can ask questions. And so we will, I have some questions to start, but we'd love to incorporate your questions and have this be interactive as well too. So feel free to look for that Q&A and ask some questions, and we'll try to filter those and get those out to our panelists here real soon. So without further ado, let me get started by first introducing our panelists. First, I have Michael Palmer. He's a partner with the law firm Barnes Thornburg. I have Shawna Neilson, the Director of Risk Management Services with insurance and benefits firm Gibson. And I have Andrew Liss, the Population Health and Analytics Manager, also with Gibson. Guys, thank you for joining me today. Really appreciate the chance to have you here.
Thank you.
Pleasure to be here.
Yeah, thank you, Jeff. Really appreciate it.
Great. Andrew, maybe I'll come your way first. So obviously the topic of vaccines is getting a lot of attention right now. It's the number one news story as they're talking about, who's eligible and what's going on with it, and do we have enough doses and all that kind of stuff. Can you just give us maybe a high-level overview of maybe where we're at in Indiana and Michigan on the vaccine front?
Sure, absolutely. So as you know, it's an evolving day-to-day process with the COVID vaccines rolling out, and those roll out in phases, right? So 1A was done earlier, right when the vaccines came out. Those were for patient-facing healthcare workers, long-term care facility folks, and staff. And phase 1B was the second part of that, which also included, started with age 80 and over, then subsequently went to age 70 and over. And each one of the states that we're talking about are handling things a little bit differently. I'm sure you're all seeing that in the news every day. So I'll start with Indiana, for example, handling it a little bit different from Michigan. Indiana started with 80 and over, then went to 70 to 79-year-olds. And as of yesterday, are making the vaccines eligible for 65 and older. So those are being rolled out at vaccine locations, and I will supply a list, Jeff, at the end of this for employers to use for vaccine locations to make it easier to communicate that to employees. Michigan's handled it a little bit differently, again, starting with healthcare workers, long-term care workers and staff, beginning in December. And also opening it up to 65 and older a little bit earlier, a couple of weeks ago in mid-January. So those folks, as well as school, pre-K through high school staff, have been opened up for a couple of weeks in Michigan. And again, I have those locations as well by county to give you. So that's kind of a 1,000-foot view of where we're at in terms of eligibility, where to get the vaccine. Again, these are vaccines supplied by the government, so there will be no cost for the vaccine itself to those that sign up to get it.
Great, thank you, Andrew, for the overview there. Appreciate that. So obviously, everybody's saying we need more, and so there's a lot of discussion about rolling out more vaccines. And as Andrew, you were mentioning, moving to the next phases. I know in Indiana, the next phase they're talking about is it's kind of essential workers and employers, and so which has really got employers now thinking about their role and what happens next, and still a little bit of time before the mass population ultimately gets it. But maybe Andrew or Shawna, let's stay on the. Let's start first with this idea of employers who have a strong desire to be open, want to minimize the spread in their business, now want to encourage their employees to get it. So let's talk a little bit about maybe how an employer approaches initially I would call it the encouragement of their employees to get the vaccine.
I think I was gonna say, I think I flipped that to you first, Andrew. Like, talk about that encouragement piece versus the requirement piece, because I'd like to then touch on because we've heard those words with relation to the vaccine as well.
And I think that is the guidance that we would suggest going forward right now is encouraging employees to be getting the vaccine versus mandating. So that kind of starts with effective communication and planning. So I'm sure there are plenty of HR folks on the line. Establishing a coordinator within your group to get that communication out, really starting from the top down, senior leadership and what we call influencers within your organization, to get the facts and rolling out that communication based on CDC guidelines. Not necessarily advocating for one vaccine or another. So right now we have two available. Johnson & Johnson is working on a third. Although the efficacy is a little bit less than these two. But rolling out that communication strategy, even though you may not have a mandate, or if you're not going to go down that road, or even incentivizing, which we can touch on later, you should be working on that communication plan right now. Part of that too that I just mentioned is being clear and providing that logistical information in terms of where your employees can go to get those vaccines. Jeff, you mentioned supply. Supply right now is an issue. So we'll tie that into a little bit more of our discussion later on in terms of opening it up as that supply grows.
And I think, as we start talking about this, one of the questions that have come up, and I don't want to talk the legality. We'll ask Mike to talk the legality around requiring the vaccine. But obviously there are some that are, like hospitals are, their workers have to get it to maintain their safety. And there's a component to this that employers need to think about, and that's workers' compensation. So let's use the four of us that are on this call right now, this panel. If Gibson required Andrew and I to get the vaccine, and one of us had a strong adverse reaction to it, it can happen, and I'm not trying to spread panic, but it can happen. The employer's been exposed now to a workers' compensation claim. They're exposed to a potential workers' compensation claim and that liability for taking care of that employee because it was required. We've seen cases like that, especially in those hospital settings when there's a lot of different vaccinations that hospital workers have to get pre-pandemic. And if they have a severe adverse reaction that causes other problems, it can develop into a workers' compensation claim. And so I think anything, we want to talk about, creating a great culture for your employees. So it's about advocating for it. How do you get it? As Andrew was talking there of, I think one of the things that we want to talk about is avoiding that you've got to do this and that heavy-handed if they're not in a like a healthcare type field, that sort of a thing. So I wanted to throw that in there while it's fresh on my mind, because I know this can take some different turns and we may not get there. So
great, thanks guys. Michael, let me come your way a little bit, and so employers are out there, they're wrestling with kind of what can they do. Obviously, so many of them have been crippled, if you will, by this economic crisis that's affected the health crisis, they have a strong interest in making sure they keep the doors open no matter what. Some of them, I think, see the vaccine as a real key component of making sure that this doesn't spread throughout their workforce. Let's start talking a little bit more about employers and what they can do.
Okay, yeah, and I think just to piggyback on what Andrew and Shawna said, is certainly one option is to just encourage your employees to get vaccinated, and to do that in the way that Andrew and provide information to them, direct them logistically how to do it. I think that's where most employers are going to end up at the end of the day. There's different legal issues that they're going to balance, but you need the other option of mandating a vaccine is certainly open to most employers, with a few caveats. And let me explain from a legal perspective what that means. So you all have probably heard of the Americans with Disabilities Act. That is the statute that protects disabled employees from discrimination. That law also requires employers to provide reasonable accommodations for disabled employees and applicants, so that they can perform the essential functions of their job with an accommodation despite their disability. Similarly, Title VII requires employers to accommodate sincerely held religious beliefs. And the Pregnancy Discrimination Act requires employers in certain contexts to accommodate pregnant employees. So these are some of the key laws that you're going to balance if you want to go the route of mandating your employees get vaccinated. And the key one is the Americans with Disabilities Act. It also prohibits employers from making medical examinations or medical inquiries unless it's job related and consistent with business necessity. And so those are the kind of the gobbledygook legalese part of it. But from a practical standpoint, what that means, if you're going to have a mandatory policy requiring vaccinations, number one, you have to have a procedure where employees can come forward if they have a disability that prevents them from being vaccinated, to request an accommodation from that policy. In other words, an exception such that that policy won't apply to them because they have some sort of disability. So say, for example, an employee with an allergy that might make them at risk to have an adverse reaction to a vaccine. If they come forward and seek an accommodation from your mandatory vaccination policy, you need to have a procedure in place to engage with them in the interactive process to determine what sort of accommodation you can make for them to allow them to continue to safely work. We can talk more, Jeff, about that if you want, about what that interactive process looks like and how it may end up at the end of the day. But just know that that's one issue you have to deal with in your policy. Same thing goes for sincerely held religious beliefs. If somebody has a sincerely held religious belief that leads them to object to having a vaccine, there again, you have to have a process in place to accommodate those sincerely held religious beliefs. And the same concept is true for pregnant employees. EEOC has come out and said that a vaccine is not a medical exam. A COVID-19 vaccine is not a medical exam or a medical inquiry. So that's good news for employers in that you don't have to meet that standard of job-related or consistent with business necessity to have a mandatory vaccine policy. But realize that some of the pre-vaccine questions that your employees may be asked, those may be medical inquiries. So the person administering the vaccine may ask if there is an allergy that could lead to an adverse reaction. And so that's a potential issues for employers to navigate as they go this route of mandatory vaccine. Really quickly, a couple other legal issues that could trip up your mandatory vaccine policy. One is if you're a unionized employer and if you have a collective bargaining agreement, implementing any sort of policy that could lead to discipline is typically going to be considered a mandatory subject of bargaining, which means that you as the employer cannot unilaterally implement a change like that unless your management rights clause in your collective bargaining agreement allows you to do so, or unless you have some past practice that allows you to implement these types of policies. So you'll need to look at your collective bargaining agreement, consider your past practice to determine whether you as the employer have the right to implement this policy without negotiating with your union. Probably makes sense maybe from a employee morale perspective to involve the union, but putting that aside, just a straight legal analysis, that's an issue to consider. Last thing I'll say is that some states are beginning to introduce legislation that would limit an employer's right or prohibit an employer from being able to institute a mandatory vaccine policy. So those are the key issues. There's some other legal issues that come up with regard to wage payment, and if you're going to have a mandatory vaccine policy, and the interactive process is an important thing to understand. But that's the big overview of legal issues. The short answer is yes, you can have a mandatory vaccine policy, but there's some legal issues to be aware of.
So it's like all things COVID, it's really complicated, and which is why we wanted to get together today and have this conversation. So appreciate that, Mike. I'm going to come back your way, and I'm going to stray away from vaccines for a second and talk more COVID, because I think COVID has put challenges on all employers in terms of respecting the the individual rights of their employees and their health conditions, but also trying to keep people safe. Right? You work in a small office. Somebody tests positive, you need to establish who they've been in contact with. Just, can you maybe Michael or Andrew, Shawna as well, weigh in on some of the ways employers have been having to adapt during COVID to kind of protect the privacy of people and their individual rights, but at the same time protect the employers there too.
Right. This has really been, COVID has really raised awareness about the Americans with Disabilities Act and those provisions that are a little bit lesser known. The accommodation process, not all employers are well versed in that. And this concept that medical information is protected under the Americans with Disabilities Act. A lot of times I'll get a call and an employer will say, well, that's HIPAA protected. Generally speaking, it's probably not HIPAA protected, but likely it is protected by the Americans with Disabilities Act. So you're right, Jeff. Navigating these issues that have come up have really required employers to balance those types of issues. So for example, the masking issue. And if an employee has some sort of underlying disability that prevents or limits her ability to wear a mask, that requires employers to engage in the interactive process and figure out how to accommodate her individual disability with, at the same time, our obligation under OSHA to provide a safe workplace. And so employers begin to consider remote work as an option, or allowing her to wear a face shield as an option, or can we transition her to a position that allows her to isolate and be socially distanced? Those are the types of accommodations that we're seeing a lot as employers navigate these competing interests. And I think those are the kind of accommodations that we're going to see a lot of as employers navigate this vaccine issue. And when employees come forward and say, hey, I need an accommodation, we're going to see a lot of those same accommodations come into play. With regard to handling sensitive medical information, employers, I think, tend to want to name the individual and say, hey, here's who had COVID, and let's do the contact tracing. And you have to be a little bit more nuanced than that. You can't identify the individual who has COVID, while at the same time, you have to effectively contact trace. So, employers have really, most employers that we are working with have developed a COVID-19 preparedness plan that they're relying on. They've thought through these issues. They've developed forms to deal with these issues. And most employers, I think, are humming along managing this pandemic at this point.
Andrew or Shawna, any experiences there with employers as they're sort of reacting to this, the changing environment and how they're handling, COVID cases in their office?
Yeah, I mean, I know from we've had the whole gamut. So to Mike's point of you don't out the positive case, we have had employers that have done that. They call us up and they're like, oh, well, we just told everybody in the company that Shawna tested positive, and so we're like, oh no, you can't do that. So it's ask for forgiveness later. So it's about having that preparedness plan, and I think we're at the point that most employers have probably had to experience it at some point. Obviously our advisement is always get your HR folks involved, because they are the ones that hopefully have all of the I call it the alphabet soup of the FMLA and the ADA and how that all pertains. But it's difficult times, because you can probably figure it out once they start doing contact tracing, and you want to protect people's privacy. But then I think, again, I'm just reiterating what Mike said. It's I have to protect the people that might have also been impacted by that positive case. And so we are definitely seeing employers putting different mechanisms in place on how they do the contact tracing. How do they know that their employees were in the office today? Are they doing their health screenings? So even though we're almost a year into the pandemic, those things we can't let up. We can't let off the gas. So.
Great. Michael, I want to come back your way with a legal question. And again, just a reminder for our audience, under the Q&A session, you're able to ask questions for our panelists. And so feel free under Q&A to add that. So a question here from our audience, Michael, about legal concerns or ramifications regarding the EUA of COVID vaccines, the emergency use authorization of COVID vaccines. If the EUA is unlikely to be lifted anytime soon, is that an additional legal risk?
That's a really good question. And just as a bit of background, the EUA is essentially it's an emergency use authorization. So it was a quicker process than full FDA approval. And it is an important distinction as compared to other vaccines that we've dealt with as employers. So H1N1 vaccine, for example, has full FDA, and therefore for a healthcare employer to mandate a flu vaccine is a bit different, because it has received full FDA approval versus this situation where you just have the EUA. The way I think there's a couple ways I think this is going to impact. Number one is because the EUA status of it, when an employee goes to receive the vaccine, he will be given instructions that it's fully voluntary. So it's a little bit of a contradiction for him to be getting an instruction at the vaccine site that is fully voluntary if the employer is mandating it. That doesn't mean you can't do it. I just think it's a bit of a contradiction. The second thing is that, I would expect OSHA perhaps, at some point OSHA is going to weigh in on this and say, employers, in order to provide a safe workplace and to meet your obligations under the general duty clause, either you have to promote this vaccine, and they really have already said that, but perhaps they'll go so far as to say it's mandated. I wouldn't expect them to do that until full FDA approval, until we know more about the efficacy of the vaccine. And so the way I think it's going to impact is that I think employers are going to have the choice whether or not to mandate while we still have that EUA status. And I can tell you just kind of anecdotally, a lot of larger employers are coming out on coming down on this by not mandating mandatory vaccines. GM, Ford, Walmart, Walgreens, all of these employers are making it discretionary while encouraging it. And I think a big part of that is the EUA status of the vaccine.
And on the same side of things, or on the opposite side of things, rather, you have employer groups that are coming out and saying, hey, we're going to incentivize this. We want our employees to get that. So a few that come to mind: Trader Joe's, Instacart, Dollar General, either offering 2 or 4 hours off of work to go get the vaccine, or a modest gift card. So we're seeing that more and more too.
Great, Andrew. That plays into a question from our chat about that. So, when incentives are happening there, any challenges from the employer standpoint of, does that potentially isolate some people in the workforce if a good amount of them are taking advantage of the incentive and some aren't? Just talk about how or help give some advice on how employers navigate that.
Right. So I think the incentives are a good idea. I think the guidance I would give right now are to wait until later in the year when the supply of the vaccines is in meeting the demand. And so in other words, right now, you have limited groups of folks that can actually receive the vaccine, so that the fairness and equity matter comes into hand. We do think that tying that to existing wellness programs would probably be an easy thing to do, much like flu vaccines or things of that nature. I think it gets into a little bit of a, and Michael, I think you just mentioned this too. So by law, employers who offer those wellness program benefits, such as incentivizing folks, must provide a reasonable alternative for folks that cannot or will not get the vaccine. At the same time, I think, Michael, you just mentioned the EEOC, which had a proposal on the table and is subsequently put on hold about the amount of that incentive. So in other words, you don't want to make an incentive so rich that it doesn't seem quote unquote voluntary anymore to your employees. And that's really the takeaway there.
Andrew, if I could maybe follow up there, because you talk about the employee wellness program. So for example, in my own case here, we hire somebody to come in and give flu shots to anybody that wants them, while, as what we think is a good practice, that we don't mandate it, we give them the option. Do you think at some point in this vaccine process will a COVID vaccine be, can I do the same thing with a COVID vaccine as I do with a flu vaccine? Will I be able to hire somebody to come in here and give my employees who want it a vaccine?
Yeah, absolutely. I think that will be the case. Third-party vendors coming in to administer that and treat it as much the same as the flu vaccine on a voluntary basis. Some programs I've seen and I've been part of are outcomes based and reward incentivized if you do that, and others offer other things in terms of screenings, biometric, things of that nature. But flu vaccines, I envision that now later this year, maybe into 2022 is when I see vendors and that supply really being available to do that.
Great. Question about students. So most of the attention today is focused on the elderly population. The elderly population's been affected at a higher number, more hospitalizations, more deaths than the younger population. But we have a strong interest in kids being back in school and such too. So any insight from any of you on how schools might best approach vaccinations there?
Shawna, did you?
It's like three not it's. How's that?
Yeah. Right. That's the third rail. No. Yeah. I think schools are probably going to approach it a lot in the same way that employers are, and consider balancing, balancing these issues of providing a safe workplace or providing a safe educational place, while at the same time respecting, individual freedom, maybe going too far, but just kind of acknowledging the morale issues and the kind of the political issues or the issues that you face with mandating. And I think it's going to be a difficult, it's going to be a difficult needle to thread to mandate. And certainly any sort of mandate that you have in the educational institution is going to have to require mandating teachers and administrators be vaccinated, who are employees and who are oftentimes represented by unions. And so it's a bit more difficult in that context than I think for most employers. But at the same time, people are really interested in having their children back to school. And I think sooner rather than later, most educational institutions will mandate, but probably not until not until later on, not until the end of 2021, not until the beginning of 2022.
Right. And I think to caveat off of that, I think the other part of that too is at least the guidance, and there's some mixed messages. The guidance I've seen with the 2 vaccines currently available, or the recommendations are for 16 and above in terms of ages. So that automatically kind of takes out some of the younger students, staff and faculty. I would certainly echo Michael's points.
Great. I had a question about future employment. And I don't know. Let me put it on the lines of, right now they're restricting travel, to future people who want to come here. What about employees, like future employees? Can employers mandate that someone have had the vaccination before they accept employment?
Yes, the same analysis really applies to applicants as it does to existing employees. So the applicants are entitled to the same protections essentially that an employee is under the Americans with Disabilities Act or Title VII or Pregnancy Discrimination Act. And so you'll still have to balance providing accommodations to applicants who are disabled or who have sincerely held religious beliefs or who are pregnant. But for those legal issues, then yes, the answer is you could still mandate applicants if your policy was to mandate employees and applicants get vaccinated.
So question, maybe Andrew, I'll come your way. So I think one of the hard things throughout the pandemic has been the amount of information coming at people from a lot of different directions, and sort of I think some guidance and stuff that feels like it's changing daily. What advice would you have to employers about where or how to tap into information to keep them up to speed on maybe kind of what's going on currently?
Right. Yeah. I would certainly my kind of go-to is the coronavirus site for the CDC. Each state also has dedicated websites and information directly related to COVID. So that would be the first place I would go for the facts. So there's a lot of conjecture out there. There's a lot of people's opinions, but that's where I would definitely start with the CDC and each state guidelines.
Okay.
I'd just add to that we can expect OSHA to jump in here within the next 30 days or so and OSHA already provides a pretty good plan for employers to follow, but you can expect more from them in the next 30 days.
I'm just curious that, in terms of employers that have got it already, if you will. So obviously nursing homes maybe were the biggest target initially in Indiana because of the number of cases there. Any insight as to how nursing homes have handled vaccinations with their guests or with their employees?
I don't have any specific examples at this time, Jeff.
Yeah, I'm sorry, I don't either. I know anecdotally medical providers, so similar in that they're working with at-risk customers, at-risk patients. Some have mandated it, some have not. So I know of some hospitals that are not mandating the vaccine.
Right.
So I think that goes to show, I think, just how sensitive this topic can be, and how I think, at least initially, especially while there's this EUA status, employers are just taking a very measured approach to rolling this out.
Sean, I want to come your way a little bit and talk about just kind of the workplace in general, kind of morale, the culture. There, obviously, COVID has taken its toll on the business environment. People are, separated, working differently. I think this uneasiness of when we'll be through this and when business will get back to normal. Can you talk a little bit about just sort of that aspect, just sort of the culture within the office and morale, and sort of how all this plays into it, or even advice to employers in terms of how to navigate that?
Yeah, I mean, it's something that we talk about. Andrew and I are on a monthly call together about, as leaders within Gibson, and it's difficult because when the pandemic, when everybody first got sent home about a year ago, it was, hey, let's do these coffee chats and let's do these happy hours and we had a parentology chat going on, and we even started a corporate the quarantines, like keeping up with everything that's going on. And then and I think we had this erroneous thought that, okay, this is, it's like the flu and it's going to go away in the summer, and then here we are in the fall and then the winter, and now we're almost a year into it. And it really is, it's taxing on our people. And I mean everyone's people. I'm not just speaking about Gibson, but it's everybody's people. And it's finding that personal connection. And I myself personally, I never thought of myself like as a people person. I mean, I can be with people and I can be personable, but I didn't really think I needed it. I was like, oh yeah, working from home is going to be awesome. But we've onboarded a dozen and a half people during a pandemic. And so, Andrew and I met over Zoom, and it's finding that balance. And so I encourage employers, you've got to maintain, you can't take your eye off the ball. You've got to maintain the safety. You've got to maintain the social distancing. But the ways that you can get creative so that your employees can still connect with one another. Encouraging your team leaders, your supervisors, your management, that you're actually just connecting with people as people, not just a Zoom because this is a webinar or we have this meeting or that meeting or whatever, but it's gosh, Jeff, how are you doing today? How's the family? And that's scary to people because leaders aren't supposed to do that, right? HR tells us you don't get to know your people like that because then we're getting into too much of their personal lives. But I think right now more than ever, what we're finding and what we're talking to our clients and folks about is just that need, that craving that people have, reminding them of your EAP. So, getting into a little bit of the benefit side here on things. If you have an employee assistance program, do your employees remember that? Because people tend to think of that as, something sad has happened or something tragic has happened, but there's a lot of people right now that are suffering because they're home. They're not with their friends. They're not coming in the morning, standing at the water cooler, if you will. Does anybody have those anymore? But the water cooler and chatting for 10 minutes about what happened the night before. So all of those things that you can just encourage. It's time, but it's reaching out and making sure the mental health of your coworkers and your friends is still intact.
And Jeff, just to kind of piggyback on that, I think that maybe employers, and I know I've fallen into this trap of hearing about the vaccine and thinking it's over. And unfortunately, that's not true. We're going to be, as employers, requiring social distancing and masking and sanitizing, throughout this year in reality. And and so the COVID plans that you have aren't, they're not going to go away overnight, even if you do mandate vaccines, because we really don't know yet how effective they are or what it even means for someone to be vaccinated. And so it's important for employers to recognize that and to find solutions for staying connected, for onboarding properly, for translate for passing along the culture that you want people to have. So not to pour cold water on everything, but I think that it is important for employers to keep in mind, keep those COVID plans front and center, have your team monitoring the CDC website and local guidance and updating them so that you're following the latest and greatest. Another point just about, and this is more a legal issue, as morale issues pop up, and specifically when it comes to your vaccination policy, whether you mandate it or you take a discretionary approach, you're probably going to have people complain about it. And that's just the reality of many of the things we're faced with these days. Our employees are going to complain no matter which choice we make. And we, I think, often lose sight of, they have a right to complain under the National Labor Relations Act, Section 7, whether you're unionized or not, your employees can engage in protected concerted activity. Sometimes it's hard to listen to that protected concerted activity, but I encourage you to take a measured approach, especially as people's nerves are a bit fried and maybe have a bit quicker trigger than they did a couple of years ago. Just to know that there's a legal issue there that you have to manage, and that you can't fire people for basically complaining together about terms and conditions of employment.
And just to take that a little bit further, I mean, this is a new vaccine, right? So it's not like the flu vaccine, and public opinion on whether the vaccine, whether they're going to get it or not, has dwindled. So I can tell you, I'm just referencing a Kaiser Family Foundation poll that I found last week. About 47% of those polled would have already either gotten it or will get it as soon as they can. But you also have about 20% that will only get it if it's mandated or will not get it at all. And now that's a little bit different from the December numbers, but that just kind of puts into a numerical value this is a new vaccine. People are still a little bit wary of it. It's under emergency use authorization, not under full licensing yet. So that's where we stand, and just be cognizant of that from an employer standpoint.
Good. Michael, I want to come back your way and with our others too, because you talked into the future, and I think that was some great advice to caution. So, because we've heard from the beginning of this that herd immunity is going to happen, right? Once 70% of the people have got this or have been vaccinated or whatever. But in our office places, we're going to be in a position where some people haven't got it, weren't able to get the vaccine, for some purpose, want to make sure masks and social distancing, continues to happen. So are we having another discussion, I guess, a couple months down the road in terms of how employers now are adapting to, even though we have the vaccination, now we got to make, these additional or continuous accommodations?
I think we are. Yeah, I think this is going to be a very fluid situation where you have half your, or probably 70-80% of your workforce vaccinated, some that are not. And what does that mean from a medical standpoint, from a risk standpoint? I don't think we quite know that yet. But as we know that, and as the CDC provides guidance on how employers should manage that risk, and how OSHA tells employers to respond to that risk, employers need to keep their eye on that guidance and not just completely stop their COVID plan, but rather continue to evolve. We're likely going to see some sort of masking into the future, into 2022, some sort of social distancing, particular folks who can't be vaccinated or who choose not to be vaccinated. So to answer your question, yeah, it's going to be a fluid situation. Yes, continue to monitor guidance, use the resources that Andrew mentioned, and stay vigilant in editing your COVID plan.
Well, I think I'd say there, Mike, to piggyback just a little bit, it's planning, right? Is how do we start maybe shifting our attention a little bit to how do you plan to get people back into the office, back into the workplace, wherever that may be. Are they staggered schedules? So, I mean, we might have thought about these things, 9 months ago, but as we're now, cases are declining, people have started enjoying being home for 9, 10, 11 months. And, who doesn't like that, I'm at home in my jammies and having my coffee and I can just stroll down and I can, do a load of laundry throughout the day. Well, it's to start having those dialogues. I mean, I think it's employers need to start having those dialogues now, that if remote work isn't going to now be forever for their employees, they need to start greasing those wheels, if you will, and getting the employees comfortable with, we're going to have a plan and we're going to keep you safe and we're working through that plan. We don't know. And because I think people just need that information, because I'm seeing that with employers right now, is that anxiety about, when are you going to make me come back? What's that going to look like? How am I going to do this? And so I think I heard Mike say a dozen times in that last thing, plan, and that's you've got to do it. It's got to be well thought out, to make sure that your employees, that they have that psychological security, that feeling.
And the good thing for most Indiana employers is that you're not the first adopters of this planning, because many of our, most employers in Indiana have been back to work in person in some capacity. And so, you can use them as resources for how they did it. Even in Michigan, as they started to loosen restrictions, many of our clients there dealt with this process of bringing back your workforce to in-person work, and how do you communicate with them in a way that puts them at ease. And part of it is, again, just relying on your COVID-19 plan to reassure them that the workplace is safe and that they can come back to work safely. So I totally agree. My sense of it is that a lot of Indiana employers are back to working in person, certainly in the manufacturing setting, but even beyond that, I think many are back. And that will impact your reasonable accommodation analysis. That'll impact your analysis of whether to mandate vaccines or not. If you've been operating relatively safely, that informs whether or not you can provide an accommodation to somebody who can't be vaccinated, for example.
On an earlier question to Andrew, I asked him about employers bringing someone into the workplace to provide vaccines should people want it. So, which leads me to believe, is we're talking about planning. To what extent can I ask my employees about their interest in getting a vaccine? Obviously, if I'm gonna hire somebody, I want to know that people are going to take it. Do I have the ability to reach out to those employees and say, hey, if we offer it, are you interested?
That might be a Michael question from a legal standpoint, but yeah. I would see, I think it would be treated much the same as flu vaccine right now has been. From a legal aspect, the only thing that I know of on the back end of that is for employees that do not want to get the vaccine, you cannot ask why. So I do know that much, but from the front end of that, I think Michael would be better.
I think, Andrew, you hit the nail on the head. It's if a vaccine is not a medical exam or medical inquiry, then asking about your preference is not likely a medical exam or inquiry. Don't have, I could conceive of a risk because I'm a lawyer, but I don't think it's significant enough to prevent you from asking that question if you wanted to. But I agree with Andrew. If somebody says no, then the follow-up question of why, that can lead you to a place you don't want to be. So don't ask that follow-up question. I think doing a anonymous survey so that you can gauge what you might want to do as an employer and the ramifications for you from a morale standpoint, that might be a worthwhile exercise. I probably would steer clear of asking that question to individuals. I just don't know what that gets you unless you really need to know big picture where your workforce stands, I think.
Yep.
Well, we've had a great discussion today. Thank you so much. A reminder, our guests are Shawna Neilson, the Director of Risk Management Services with the insurance and benefits firm Gibson, Michael Palmer, a partner with the law firm Barnes Thornburg, and Andrew Liss, the Population Health and Analytics Manager, also with Gibson. Guys, thank you so much for being here and being part of our conversation today and helping employers better understand these crazy times that we're in. Your insight today has really helped them, I think, better prepare for what the months ahead. And we appreciate you sharing your expertise with us today.
Thank you for the opportunity, Jeff. Appreciate it.
Yeah,
Thank you, Jeff.
So again, a big thank you to Gibson, our sponsor for our Networking at Lunch series, and appreciate the great partnership that we've had with them, and especially today, them making a few of their experts available to us, and we look forward to continuing that great partnership. Just a quick reminder to you on the event front, I want to do a quick plug for Salute to Business. As you know, that's our annual big event that happens in this spring of every year, planned for March 16th at lunchtime, and hope you'll pencil in and join us for that. We're going to go virtual this year because of the pandemic, but we have a phenomenal program, a terrific speaker, somebody I think you're going to be really excited to hear about. And so watch your inbox the next couple of weeks as we promote that event and so many other things that we're doing. We, like all your businesses, are adapting and pivoting to keep our members engaged, and we'll look to continue to bring meaningful programming throughout the rest of the year. Until then, I just want to say thank you for your investment and your confidence in us and our team. We're grateful to be your partner, and we look forward to seeing you again next time.